Okay, interesting. How well do these GLP-1 drugs work? Can you give us a sense for that in terms of the magnitude of the weight loss that people are seeing when it works, as well
Mm.
as the percentage of people that it actually works for?
Yes. So the first generation of these drugs were approved by the American authorities, the FDA, in 2014 and marketed under the name Saxenda. And this is the drug we just talked about called liraglutide. This was a once daily injectable, and it had approximately 8% weight loss over 1 year in individuals with a BMI above 30, so what we classified as individuals with obesity. Um, and then there was this development with going from the liraglutide to the semaglutide with the once daily to once weekly. And I think it was a little bit, I mean, it was just, I think it was unexpected that the weight loss was so much potentiated with that modification. So the once weekly drug in individuals with BMI above 30, 1 year trial, you see weight loss of 15% approximately plus minus. There's now been so many trials, but up to 17% with this type of best-in-class GLP-1 receptor monoagonist. And typically then we talk about the Novo Nordisk compound semaglutide, which is kind of the leading one when we talk about the monoagonist drug. But there's also then the dual agonists that are now entering the market, and maybe we can also talk about them later.
Yeah, we'll get to that later. The drugs that are out there, the once weekly
Mm,
injectables, the Novo Nordisk version, we're talking on
mm.
the order of 15% loss of body weight.
On average, in individuals with obesity, BMI of above 30. And then out of those 15% average, there's of course a large variability in how people respond to these drugs. So typically around 15% we classify as non-responders, meaning they have get less than 5% weight loss.